In this video, we will talk about fat embolism syndrome. So when you undergo a long bone fracture or you undergo fixation of that long bone fracture by means of intramedullary nailing, in that situation, what happens is that the bone marrow present within the long bone either oozes out or is pushed out by the nail. The bone marrow within the long bones in most of the adults is yellow bone marrow, which is made up of mostly fat. These droplets of yellow bone marrow or fat droplets come out from the core of the bone and into the blood vessels. In the blood vessels, these small droplets of bone marrow act as fat emboli. These fat emboli travel down the entire path and go into the lungs and finally into the perialveolar capillaries. And in the perialveolar capillaries, these fat emboli block the perialveolar capillaries and lead to ventilation perfusion mismatch. And a scenario similar to pulmonary embolism. Situation very similar to pulmonary embolism, which manifests as hypoxemia, CNS depression, and petechial rash. Now, this scenario occurs within less than 24 hours of the fracture and is manifested by hypoxemia, which is your PaO2 less than 60. Then you can have CNS depression. You can have petechial rashes, rash, fat in urine, etc. These are the clinical manifestations of this condition, and these are also the diagnostic criteria as well. Now, what is the treatment of this? The treatment of fat embolism syndrome is basically your early fixation of long bone fractures, and if possible using external fixators.